is the functions of the apana vata. Urination, maturation, urination and elimination of the feces, menstruation, ovulation, sexual orgasm. You know, these are the 5 main things is mostly connected with the apana vata. Okay. Again, what are the apana vata imbalances? Elimination, not imbalance, sorry, functions. Elimination, urine and feces, and menstruation, ovulation, ejaculation or ovulation, and sexual satisfaction, orgasm. And these whole are apana vata, the balancing and functions. But when you go to very little bit far ahead of that, the Shukshma apana vata or the subtle apana vata is helping you the implantation. You know, carrying the egg from womb to fallopian tube to the place, uterus, and this kind of thing, subtle energy is doing some other functions as well. Okay, and this is the apana vata functions. Then apana vata imbalances are. What are the apana vata imbalances are? Anything to do with the elimination. What are the anything to do with the elimination happening? Constipation, diarrhea, and rectal prolapse, and some piles, some the tenesmus, you know, like the difficult to go to toilet, you know, like the prolapse with happening. And when you come into the urination, urine infections, you know, maturation, urgency, frequency, this kind of thing is coming like a, and urinary calculi, yeah.
Isn't, for example, in the case of piles,
yeah,
pitta?
Pitta link, and when you go into piles, there's a vata type, pitta type, and kapha type piles. Vata type piles is outer layer. Second layer is the pitta type. Third layer is the kapha type. Outer layer always is, you know, that's the beauty of Ayurveda. If somebody comes from piles, we are not talking to like we have to ask the sign and symptoms of the piles. You know, if you have some people have the tags, you know, nothing to do with that. Especially when you give the birth, you have piles can occur. There is no bleeding, and there is therefore like little bit skin tag. Why is that? Because of the too much pushing the vata imbalance, and the outer side of layer is in balance, and then is coming like vata, and it is not giving bleeding or anything like that. Sometimes itchy is stay there and coming and going, and if it is vata imbalance happen, it can be infection and thing can happen. But pitta type 1 is a different one. Second layer, it is like normal piles mean is a pitta type 1, but it doesn't mean the vata piles appear. Vata piles so many appear in loads of constipation people, overs, tenesmus, you know, putting too much pressure, and after childbirth, vata type piles appear, and it's different than pitta. Okay, and kapha type more different. Okay, like that. But you know, don't worry about that. Don't understand which layer it's coming from. Understand the nature of the piles and where it's linked to, and then you can see like vata type. And for example, one of patients saying to you like, oh, I didn't have piles before. After childbirth, I have a little bit skin tag came on, and it's look like piles, but it doesn't hurt. But sometimes when you're imbalance, it's fine, a little bit itchy, sometimes a little bleed, you know, and that is going to be the nidana is or the what the patient consume is vata imbalance, you know, like pushing too much, and apana vata, and it's appear to be vata type kind of piles. Okay, is that clear, Noel?
Yeah.
Okay, and like that. Okay, and then coming to the urinary tract infection, more like urinary tract infection also the same, mostly pitta, but is pitta and vata involved. Why vata involved? Vata kind of urinary infection, because is obstruction give you infection like more rather than the fire. Obstruction. What is the obstruction give you? The people don't have too much water. Who doing that? Vata. And people who control the natural urge. Who is that? Vata. And people who is like having too much pressure, frequency, or maturation, like little bit of either passing too much or passing little. And what happened? And this place can be irritated, and then pitta is coming, and then like vata is like, come on, I'm having fun, can you come? If you don't come, I will bring you here, and then like that they both having the involvement, and then pitta is going to be there. And that means mostly in a countries like that here has pitta imbalance making the urine infection. But like Sri Lanka or the Africa, or because of the climatic changes and the people's and more vata involvement having a urine infection, that's what they have high rate of calculi. In here less calculi. There's so many people in a kidney disorders too much in Sri Lanka, and calculus, calculus means the stones quite appear in Sri Lanka, because why? Less kind of drinking water or less kind of circulation. But here circulation is too much. People drink too much, but people drink not water, they drink alcohol, and that means alcohol have hot, and they don't drink the water, they drink too much orange juice. They don't drink that. It's like what they're drinking is make you more prabhava, is like heat, and it is more appeal to heat rather than cold or the urine. Okay. Do you have any problem?
No.
No. Okay. Everybody listening. That's good. Okay. And then what happened is like apanavata. The second, first one is like urinary tract, the urinary tract infections. What are the other things? The maturation happen. Yes, calculus. Like sands in the stream, and it is very painful, and it is very vata type of disorder. Why is that? Circulation, like obstructed by the calculus made by calcium. Okay, and more calcium. Why the calcium making it too much? Concentration. When you're not drinking a lot of water, the uric acid concentrating, and it is making like sand. Sand make together and having a little bit sand with some kind of ball, and that means it's obstructing the circulation, and it is very painful condition appear in a vata type of infection, not infection, disorder. And then later on stage it can be inflamed by the pitta, because when it is something obstruct, is the temperature going up, bacteria going up, like because it's all flow of the bacteria going out with urine, and then it is obstructing, and then the concentration, and then everything, urine calculi end up with a urine infection like pitta. Okay, and I'm talking about the vata only at the moment, sorry, don't get complicated. Okay, and then vata type in a menstrual cycle. What is happening in the vata peoples? Polycystic ovary syndrome. What is polycystic ovary syndrome? What is the polycystic ovary? Anybody have an idea of polycystic ovary syndrome?
Cysts in the ovary.
This is ovaries. Okay, not there, most there. Sorry. Yeah. The ovaries are like that. If you come into the ovary like this vagina, this is uterus, and this is uterus wall, endometrium. This is fallopian tubes, and this is ovaries. Okay, and this when you have the where the eggs is forming in? Ovary. like little dots in here, and it is not, it's is how many eggs is normally is 8,000 eggs can be there for how many 8,000 eggs is there once a month. I don't 56 days time to 1 in a 56 days every ovary is releasing egg. One ovary is releasing 1 egg in a time, and 50 days 6 days time other ovary is 56 days time, and that means it's coming like a once a month. Okay, one ovary is mature, one egg is mature, and if it is egg is having a sperm from somewhere and it's travel together and implant in here, and it's implantation and it is going to become a the child. If it is not, it's the and prepare the day 14 the egg giving a signal I'm coming, and to that signal the endometrium is performing with the ready for the implantation with the what is it, the red, like kind of it's correct appear to the egg. Is this one is preparing their wall with the blood and all the thing, and then all the muscles and blood and everything. And what happened was the egg is not implanted, and then 28 days to 30 days this the endometrium is destroying and coming through the vagina and weeping the womb. This is like because my egg didn't get fertilized, and I am weeping for that, and then this whole weeping is coming like a blood, and that is called menstrual cycle. And you have a little bit picture in there. Okay, ovaries, endometrium, fallopian tube, the vagina, womb, cervix, these are the things. And then this is called eggs, this is womb. Okay. Polycystic ovary, what I'm trying to do, polycystic ovary mean what is it? Polycystic ovary mean no. This is like PCOS mean this ovary is still hyperstimulation. Like because of the imbalance of water. That means this lot of eggs can come, but it's like follicles. Now it doesn't. Normally the eggs comes. If that egg is mature from day 10 to 14, is mature the level to find the husband. The sperm. But in this case, this too many things is producing, but none of them is becoming this big. Okay, and then it is like becoming like a little cystic drops, and then this is like a polycystic ovary syndrome mean that eggs hasn't got any more strength, but too many eggs is releasing without the strength, and that mean it doesn't mean like it is preparing this wall. Sometimes polycystic ovary people have some problem with the periods and no periods, too many periods, and because according to this signals, this one is like up and down, and that's what is called polycystic ovary syndrome, because we can't sometimes this good egg comes and this preparing, but it's still not happening that egg is not mature, and this signal is going here and there, and that means some days they have good period, some days no period for 6 months, because these polycystic little cyst is like everywhere, they don't mature to the giving the signal to this womb, to the brain to prepare this endometrium, and that means polycystic ovary people sometimes not having period for 6 months, Sometimes they have period and then period for 10 days, you know, or 15 days and 20 days, and this is called polycystic ovary. And why polycystic ovary? Because of the water is doing nonsense in here. Why? It's like it can't, you know, too much hurry come in and they can't get the, you know, like egg out in a right way, and it's a water disorder. Yeah.
If people take contraception like the pill or
Yeah.
the coil, would that sort of increase polycystic ovaries?
The coil and the any hormonal disorders, hormonal tablet they're taking, they give in the false identification of the egg, you know, and then the sometimes the is like a Dianet kind of thing, give you high progesterone. High progesterone means the ovary feel like I already produced the egg, because after you produce the egg, after its implant, is the progesterone is releasing. Progesterone releasing, that brain thing, I already in a different time of my cycle, and that means this egg doesn't get, the ovary didn't get the chance to produce the egg, and that means when you have done it a long time, you know, like that kind of progesterone high pill, what happening, this whole the signal procedure is changing, and sometimes it feel like forever that they didn't get the message to produce the egg, and that means when you have the Dianet kind of thing or high progesterone tablets, and this kind of signals losing, and that means this they have egg but they can't get the signal to produce the egg.
I think one of the symptoms of people with polycystic ovaries is they have a lot of facial hair.
Facial
Yeah.
hair, yeah. Why is that?
I don't know. That's why I asked.
I said to you last time, dhatu. Then when you vata block, when you go into other dhatu. Other dhatu, what is it? Majja, asti, and then there the byproduct, what is it? Hair. And instead of hair producing, because the vata can't do, you know, that's the, you know, like it's like rushing people. Come on, go in there, and come on, go in there, you know, like that. And that means this last dhatu is the one the egg is producing, and then too much water in a system, and they go into second level. And instead of going this way, now you're like, come on, that's why we finish. We're going upward there, and then whole mess up in up and down, and you know, and then you can see the polycystic ovary people, and instead of having hair in hair, they're having hair in pubic hair and other, and losing hair from the hair. Why is that? Because it's involving the pitta. You know, the body getting frustrated. Progesterone is high, and progesterone when you're high is losing the hair. You know, and then the dhatu, the other dhatus is the upadhatu. Some one is like coming on, and that means a lot of hair can produce everywhere. And then what happens is polycystic ovary. This. Oh, I'm going differently now. But you have to understand people coming in polycystic ovary, and then what is the symptoms are, and then what happen is like the polycystic ovary like that. What happen when you have a IVF? What is IVF mean?
In vitro.
Yes. What is IVF doing? Increase now. The increasing FSH level. High FSH.
Oh, yeah.
FSH means
Follicular
stimulating hormone. Follicular stimulating hormone means some kind of hormone is releasing in a period's time. Day 10, day 7, day 5 to 7, follicular stimulating hormone. Follicular stimulating hormone is affected to one follicle and come into here. Okay, I'm coming, I'm maturing, I'm coming out, and I'm coming to the space. And it is 16 to 23 diameter comes, micrometer or something, and is the egg is ready for implant, you know, or the meeting the right guy. And what happened? The polycystic PCOS, the FSH is going too high. FSH normally has to be under 12, 6 to 12. And polycystic ovary syndrome, FSH going really high, 12 to some people going 30, 50, 100, okay, FSH. And then when you go in 30, 50 or 100 or something like that, that means this is like pushing the egg, and that's why it's a lot of little eggs coming, because it's like FSH running and follicular stimulating hormone and stimulate and get a lot of eggs. None of them are good. But what IVF doing is, instead of 12, they give a 300 time, 600 time, 900 time FSH. Can you believe? Can you believe that we need to have under 12, and they bring whole egg out? And that's why it's like, I got 30 eggs, I got 12 eggs, I got 50 eggs. They don't know what they're doing.
But they do that for harvesting, don't they?
Harvesting.
Yeah.
And that means, don't care about one egg. I will push you, take all eggs out, and I harvest somewhere else. I'm not wrong, I'm not against with IVF at all, but you have to do what you do into your body, you know. And like what we're doing with the Panchakarma is we pamper this one. We apanavata balancing, and do go outside the unnecessary avata, and you go your place. I pamper you emotionally, and we give this one egg full support to come out. You know, pampering, making it nicely, and give the right environment, and you know, to the body, mind, and then we give best chance ever to this little guy. You know, and coming up, and it is taking it, and it is like beautifully implanting that area. But this one is a destroying the body. Destroying mean, can you believe, you know, like 6 to 12, some kind of polycystic, the FSH can make it to the 900,000, you know. And then this is the little dose. They call, oh, I didn't have lot. You know, I have done IVF with a very little dose. It's a 300. And 900, the 1500 is the biggest dose. You know. And then that means, you know, some people come in, came one of a girl, 26 years old. Premature ovarian failure. And they give Harley Street under best consultant, done the 3 IVF, you know, and each one is 12,000, because my best consultant, best possible chances, because she has she was 26, medical advice, they have a low ovarian research, like we call this AMH. You have to see this kind of thing, FSH. What is this? AMH means anti-mullerian hormone. And it says about egg reserves. Egg reserves mean how many eggs having in your womb, you know. And then normally had to be 30 to 60. You know, it's average, you know, like according to their age, 30 to 60. But mostly people coming to you with fertility problem, they might have under 10. Okay, they will tell my AMH level under 10, my AMH level is 2.5, my AMH level 0.005, and this kind of thing they will tell you. And that means how many eggs, predict how many eggs they have at that moment. Don't get this wrong. At this right moment, how many eggs that they have. Okay. Even they told us there's egg reserves. You know, I proved to. I have a record. egg reserve is, according to Western medicine, never change, and that means permanent thing like egg reserves are how many eggs is left in your ovaries at this at this time. But when you give Ayurvedic medicine, egg reserves 2.5 to going 30. How is happen? How is happen? Because these guys are fed up, you know, because they I'm not coming when you're doing this kind of thing. I'm not coming, you know, stubborn. And as soon as we give the other part, this like they have that. This one is called epithelium. Epithelium is like little tiny little kind of skin, and then the eggs is attached to the epithelium. And one egg come in, the 800 not come in, one egg come in, 2 months time, 56 days time, you know. And then these, because AMH level means they going to have one of the gynecologists came to me and she said, tell your patients AMH is not a correct, valuable kind of method to see your egg reserves, because it's like at that certain point they can see the only epithelium how many eggs they have, but it doesn't mean they can predict the here where what they doing. And that means AMH, they have a AMH low people, that means antimolarium the egg reserves. What I'm saying is that girl who come to see me 26 years old, and because of the AMH they predicted after 2 years having sex no babies, they go to doctors and they said your AMH level is 0.2, and that means even 26 years you have no eggs and you have very very low eggs, and then they rush into the IVF for 3 times, the best doctors, best possible chances they give, you know. And what happened? Came to me premature. Every time they couldn't harvest that much eggs, 3, 4, 2 kind of thing. They give a 3 times, 4 times IVF, putting another round. None of them is not. But then when she came in 26 years and she said to me, I have premature ovarian failure. That means my ovary finished. My eggs not there. And I don't know what to do. They asked me to adopt the child. You know, she got 2 children. Now she got 2 children, you know, and Falguni, you know, the girl, you know, the 2 children. And how is happened? 3 times premature ovarian failure, no eggs, 26 years old. And, you know, because it's like this apanavata need to be correcting. You know, that is the problem, yes.
There's a question from Maitri. She's asking, going through IVF, is there an emotional effect on the baby?
It is so hard to discuss, you know, emotional effect of the baby, you know, like, don't you think, you know, like, this procedure, going through too much, you know, this is conscious level you're talking about.
The egg is frozen.
Egg is frozen sometimes.
So I've always thought that's I could never understand if it's a living thing.
Yeah.
And it's frozen.
Yeah.
I don't know. I can't understand that.
Yeah, it is the technology they're using. It is, yeah. There's like a half dead, is it, for a long time.
Dead, yeah.
You know, like, you know.
Basically,
And
remember, you keep it dormant in nitrogen. That's what you do. And when they give you, I think about 48 hours before you have implantation, then they will basically put it in the right temperature,
yeah.
so to speak.
But they don't know really, do they? If
No,
that has-
they
No,
don't
they
know.
know it's going to
They
be
don't
bad
know
and
the
all
effect
that.
of the people's mind in the future.
in the future.
Yeah, and they don't know, because it's like, generally speaking, this is the go against to the nature. You know, this is go against to the nature, and who we think we are. You know, the nature is much bigger source than us, and that means, I don't know. It's like it's all to be subjected to be discussed, but I don't know what it is. Too many people have IVF, and then the thing is, the recently one of a doctor, she's pregnant. She's might be 30, 28, because last when I seen the patient in July, and then July she came to see me. That last patient is pregnant to me, and she might have 36 weeks might be now, 26, 36. She's a doctor. She said she has same thing, premature ovarian failure, IVF, 3 times, 3 procedures. Because every procedure is not one thing, is it? This is the FSH and harvest. Then they have to give a high progesterone to make the implantation. And implantation, progesterone you need 30. They give you 300, 900, and that means to catch the monkey, catch the egg. And then progesterone going high, all the other problem, woman like a devil, because it's a high progesterone, they can't, the IVF going through people is going through really big emotional roller coasters, it's a big, and this is the one we hiding to the women, and actually women knows all the things. They think they have to promote somewhere else, this is the way to go, this is the way to try this one as much as you can. Give your child a better chance to come, kind of thing.
Would you, with polycystic ovaries, would you recommend to treat it as soon as possible, or is it something that you would treat
As soon as possible? No. Soon as possible. Don't stay until when another thing is a polycystic ovary syndrome. The people GPs identify, they don't have anything to do with that. Rather than they give you the metformin.
I offered the pill for it, and I didn't want that. That's all I could be offered.
Yeah, pill or the metformin. They give you
Yeah.
metformin. Metformin is metformin is a, what is the drug for?
It's a diabetic drug.
Diabetic drug. They think because of the metformin, they can thinner the outer line of the ovary.
They do that as well for people who are overweight with metformin.
Yeah.
What they do is to reduce the estrogen, because fat
Yeah.
with the estrogen.
Yeah.
So basically it increases your estrogen in your blood. So they wanted to give so you lose the weight with the metformin.
Yeah.
If your weight is related to estrogen rather than any other systemic problem,
Yeah.
then you would reduce the weight, and it will give you a better environment to conceive naturally, rather than that what they try to do.
But it's
most of it end up having
IVF,
Yeah.
and the most of end up with the diabetes. You see.
They can have gestational
Yeah.
diabetes afterwards.
Afterward, because this is without any clue, they have insulin because of you can reduce the weight. With the reducing weight, you can reduce the fat layer out of the ovary, which is, they think, a little bit interrupting. This eggs comes out, and then you lose weight around that fat layer, and then you can have better chance to. But I think it's all about, they think it's a different way, but it is not hormonal way they thinking.
No, but it's not believed by many. I know I've worked with a few gynecologists. There's only a few around Surrey that believe in the metformin system.
That's what I'm saying. One doctor is not believing, other gynecologists think. And some gynecologists come in with I give metformin, and when you go to another gynecologist, she asks me to stop the metformin, and then because you might end up with the diabetes. That's what they're saying. And like that, there's no such a thing in there. But your question is, that they can give you a pill having progesterone. Progesterone. You have Dianette or something. They give a Dianette or the.
No, I didn't take anything.
Anything. Okay. They can give you Dianette or some kind of what called the
What's
Dianette.
Dianette also is given for people who've got spots, acne.
It's because of the
Yeah,
the
like
progesterone.
Probiotic?
Yeah.
Oh.
Yeah, it is.
I may have in the past taken that
Oh,
when I
okay.
was young.
Yeah. The Dianette is like a complete progesterone. Don't touch them if you can. don't touch them because it's like it's a high level of progesterone, you know. And then this whole thing is like available. They play. This is a game them to play. They don't know what it is. This is the easy game to play. Correct your Panavata, you know. And then it is all your acne. Why is acne? It's like going with the Udanavata, you know, fire. Is you know, like the whole thing is like imbalance, you know. And anyway, what I'm trying to say is polycystic ovaries is another one. Okay, the whole thing, you know, you can what this lecture you can pass forward. In all people have like your recordings and fast forward and write notes, because I did a lot in this place, you know. The only, you know, I can't if you want to recall it, you go when you go home, put that video again and take it all the notes and the structure of the womb and polycystic ovaries, endometriosis. Endometriosis means build up this one, because of the, again, endometriosis involve pitta. I will tell you later. And this one is mostly is happening again progesterone. Progesterone is responsible for building up the corpus luteum, this layer. But when you have too much progesterone, this layer is building up everywhere. And then endometriosis, or the blood and all the things coming from the vagina sometimes. It's coming from the uterus. It's coming from the urinary tract. It's coming from the anal canal. You know, it's disgusting, you know, what can be done with this kind of pills. Because it's an endometriosis thing. Okay? Yeah.
Question. He does when the egg fertilizes outside the mother,
Yeah.
like using egg donor, how that affect to the baby?
Egg donor.
Yeah.
The egg donor mean
She mean like when
surrogate
fertilized
mother.
outside the mother and then place it in the womb.
Yeah.
So it's using someone else's egg.
Yeah.
So she asking how they affect to the baby emotionally.
Look, it's like the thing is, when you go into this kind of thing, you have to prepare. You know, whatever the outcome is, I will make it better, because none of them are not good. You know that, I know that, your heart know that. You know, IVF is like you manipulating the system, and if you do have a chance, the people who go into IVF, I never feel like I can't stop it, because their desperation and they wanted to be a mother, they having their burning desire for having a child, and then do it in a better way only. And what outcomes comes, you know, the child, you could make a much effective, connect with the child and taking the whatever the effect you put into the child away from that. And then egg donor or donor egg, you know, you have donor egg. You know, I have one of a patient of mine, donor egg, she's taken the donor egg from the 52 years old, when she was 52, and then she gone through the IVA, the donor and everything, and she's a little bit tired because of the, you know, when you're 52, when your child come in like 1, 2, 3, 4, and it is kind of tiring. But you know, you see that woman, that patient of mine, and because of that, she thinks, and you know, I could do different way, but I have the only chance there, and she make much effort than their normal child, and given you a nice private calm school, and given you right food, and 24 hours given you the attention, and they put that much effect to that kind of children. I don't know, it is the way, I think, because there is no other way. You know, you sabotage your body is different matter, but it's your conscious, you take your control from your head, but the child shouldn't be suffer with what your decision. And that means, as a conscious mother and father, what you have to do, more there for the child, because you don't know that for child what is the outcome is. Okay? And other than that, I can't say what is the because when you talk to your heart, you know it is not I am screwing the nature, I go against to nature. nature will provide some imbalances to me, my child, and then make it like better in a way, you know. And that's all I can do, because I know people's desperation, and